Well, a lot of times people postpone doing their physicals for the fear factor. I call it the ostrich syndrome. If they stick their head in the sand and ignore it, it'll go away. And it's the old proverb of the most dangerous enemy is the enemy unforeseen. So if we know something's coming, or we can have an idea that an illness is going to come down the road and make small changes now, oftentimes by changing course, you can avoid that illness altogether. So rather than being retroactive and having to come back and chase a disease after it's already occurred, we try to be proactive and make the changes before it occurs. One of the tests we do is called a hemoglobin A1C, and what it measures is tells us what a person's average glucose has been for the previous 60 days. It's a test often used to monitor diabetics' compliance and how well their blood sugars are running, but we use it in all our patients, get it as part of their baseline labs. Even just year to year, even if they're not diabetic, we can see the changes. Their A1C is going up. It may reflect a change in their diet. It may reflect that they're getting early diabetic changes or glucose intolerance and necessitate a change in lifestyle, again, before they get the disease. That's just one of the 87 different lab values or metrics that we get from the blood work we do on patients here. There's others that are also very much proactive that can pick up diseases like hypertension, especially cardiovascular disease, especially diabetes, years before they actually cross the threshold and have the disease by criteria.